Now, the coronavirus pandemic has exposed some gaping holes in Africa's healthcare system, and now the World Health Organization has warned that Africa, which is home to almost about 1.3 billion people, could become the next epicenter of the pandemic. Now, according to a study by the WHO, the pandemic could kill almost about 190,000 people in Africa in just the very first year if it is not contained. The study suggests that the pandemic could infect between 29 to 44 million people across Africa. Now, these shocking projections are based on the assumption that no containment measures have been put in place. 47 countries in Africa currently have a total of more than 53,000 cases and more than 2,000 deaths. The infection wave has hit Africa later than most countries, but the WHO believes that it could still translate into a prolonged year-long outbreak if it is not contained. But this isn't all. Now, another survey also shows that for every 100,000 people in Africa, there is less than one intensive care bed and one ventilator. Clearly, Africa is not prepared to face the pandemic. Now, on an average, 12 patients could be lined up for one ICU. Even in the best-case scenario, the continent could need at least about 10 times the number of the ventilators if the outbreak were to peak. And not just the lack of beds, they're also extremely unevenly distributed throughout the continent. It's not just ICU beds we're talking about. Ventilators are critical in the battle against COVID-19, and this is where the things begin to get a little scary. For the entire continent of Africa, there are just 9,300 ventilators. Out of this, South Africa has about 3,300 ventilators, but about two-thirds of these are in private hospitals, which most people just cannot afford. Some nations, such as Guinea-Bissau, have no ventilators whatsoever. But even with availability of equipment, the healthcare system in Africa is majorly understaffed. And according to the World Bank data, one doctor reportedly attends to about 80,000 people on the continent. Currently, the number of cases in Africa are just marginally low, but low levels of testing also makes it impossible to know the actual scale of infections. Since the outbreak, Africa has carried out about 685 tests per million. And this is in stark contrast to Europe, that is conducting 23,000 tests per million. But even with a grim forecast, many African nations have moved quickly to contain the virus. Countries are restricting movement and repurposing factories to produce equipment to tackle the pandemic. Now, international organizations, including the WHO and World Health Organization and the World Bank, are currently helping the continent. The World Bank is helping more than 30 African nations with over $1 billion worth of equipment. And also, WION's correspondent Michael Belike, who's been tracking this story very closely for us from Uganda, has sent us this report from Kampala, isn't it?